Hello friends, I am Dr. Rohini Ruhil. Recently, Union Budget has been passed for the financial year 25-26. So in this video, we will discuss the health component of budget, the health budget 25-26. So friends, the other name for budget is annual financial statement, which is used in our constitution. Now there is one appropriation bill. This appropriation bill gives power to the government to withdraw funds from the consolidated fund of India. So the government, according to this bill, it withdraws fund from the consolidated fund and does the expenditure. But the government cannot withdraw any amount of fund anytime according to its will. Article 114, Article 114 of the Constitution, it says that the government has to get the budget passed from the parliament and it can withdraw money only after receiving approval from the parliament. So this is the importance of the union budget. So friends, here in this slide, you can see the expenditure of major items. On the left hand side is the expenditure of the last financial year, that is for the financial year 24-25. And on the right hand side, you can see the expenditure of major items of the coming financial year. This is the budget which has been passed recently for the financial year 25-26. So here you can see that first priority has been given to defense sector last year also, and always like the priority has been given to defense sector, and its budget is almost four times the budget allocated to the health sector. Like last year also you can see that budget allocated to defense sector is almost more than four times the budget allocated to the health sector. This is because the socio-political environment, the strategic position of the India, and it is so important to secure our boundaries, and also the kind of atmosphere we have in the world, the conflicts, wars, socio-political tensions. So that's why defense is given priority. Then next priority is given to the rural development sector. You know that 70% of our population lives in rural areas, so the development is of utmost importance, and that's why it's given priority. Then home affairs, agricultural activities, education, and then the priority is given to health. And last year even IT and telecom was given priority before the health, but this time IT and telecom is behind. So friends, here you can see expenditure of major items in a graph form. So all these sectors, these are social determinants of health. So again, as I told previously, priority is given to rural development. Then we have education. Education is social determinant of health, and its budget has been increased marginally. And if we talk of health, so this year almost 1 lakh crore has been allocated to the health sector, and also similar budget is for the urban development. Urban development is also very important social determinant of health, and so is the social welfare. But if you will see the increase over the years, so the increase has been marginal. Only marginal increase has been done to all these sectors over the years. And if we talk of health particularly, this green line, there is marginal increase. And also if we talk of the total budget, so total budget is around 44 lakh crore rupees, and out of this 1 lakh crore rupees has been allocated to health, and which is around 2.3% of the budget. So 2.3% of the budget has been allocated to health. But if we talk about developed nations, they spend around 6 to 8% of their total budget on health. So we are far way behind. And also if we talk about percentage of GDP, remember this is percentage of GDP, which is different from the percentage of budget. So in National Health Policy 2017, National Health Policy 2017, we set a goal of spending 2.5% of our GDP on health by the year 25-26. But here if we see this 1 lakh crore, so our GDP is like more than 100 lakh crore rupees, and out of that we are spending less than 1%. Like now we are spending less than 1% of our GDP on health. So I would like to say that from so many years health has not been given priority in the budget, and we are not investing sufficient amount in our health. But whatever budget has been allocated, let us look at it component wise, that how much budget has been allocated to which component of the health budget. So friends, major component of the health budget goes to FlexiPool. FlexiPool under NHM, National Health Mission. So this covers expenditure for the RCH, for the health system strengthening, for several national health programs, for NUHM, National Urban Health Mission, and 30,000 crore rupees has been allocated to this FlexiPool, and total health budget is around 1 lakh crore rupees. So out of the total health budget, around 30% of the health budget goes to this FlexiPool. So friends, apart from FlexiPool, if we talk about other major schemes in the health sector, so government is focusing on Ayushman Bharat. The government is promoting Ayushman Bharat to a large extent, and especially the PMJ component of this, Pradhan Mantri Jan Arogya Yojana, in which 5 lakh insurance coverage has been given per family for a year for the tertiary care, and around 9,406 crore rupees has been allocated, which is significant increase from the last year. Then next major component is infrastructure maintenance under the Department of Health and Family Welfare, and this is same as the last year. Then comes the other components like Pradhan Mantri, this Ayush Bharat Health Infrastructure Mission and Department of Health Research. So these components we will discuss in next slide. So like for now, you can see that Ayushman Bharat PMJ and the infrastructure maintenance are the major heads under which expenditure is done for the health. Now, if we talk about other components, like in the previous slide, I told you that major expenditure is on PMJ component, then infrastructure maintenance, and after that, Ayushman Bharat Health Infrastructure Mission, 4,200 crore rupees, which is significant increase from the previous years. Then next is Department of Health Research, this DHR. This has been given priority because the government is giving priority to the research activities in all the sectors, like whether it be science and technology, engineering, and also the health research. So the budget of health research is increasing significantly year by year. So this year 3,900 crore rupees has been allocated to Department of Health Research. The next focus area is AIDS and STD control program. Its budget is also increasing year by year. So now also there is an increase. 3,443 crore rupees has been allocated to AIDS and STD control program. Then is the Pradhan Mantri Swasthya Suraksha Yojana. Then this development of pharmaceutical industry. This is from the other ministry, Ministry of Chemicals and Fertilizers. But this is like also related to health. So here I am discussing that also. So this budget has also been increased. Now National Ayush Mission is under the Ministry of Ayush, which is a different ministry from health, but this is also a priority of the government, and its budget is also increasing year by year, and this year 1,275 crore rupees has been allocated. And then other schemes. So let's discuss these small components in next slide. Now these are some other components on which expenditure will be made, like Global Fund grant under COVID-19 response mechanism, Jan Aushadhi scheme, now National Digital Health Mission, this digital health mission, there has been increase. 340 crore rupees has been allocated, and which is increased from the previous year. Then national telemental health program, this also has been allocated 80 crore rupees, which is increased from the previous budget. So these are some small components. Now coming to some other new provisions in the budget. One important provision is the daycare cancer centers in all district hospitals. So all district hospitals will have daycare cancer centers. So focus on NCDs and cancer care. So this is also a major focus of the government. But let us see how much it materializes on the ground. And also focus on medical education. It has been proposed that 10,000 additional seats, and they have goal of 75,000 seats in the next 5 years. So again, how much it materializes, we have to see. Then welfare of the online platform workers. Now this is a new provision which is very important these days. So this health budget includes provision for the welfare of online platform workers. So one is the registration on the eShram portal, and this initiative aims to ensure that online platform workers, they are registered in this portal, they get recognized, and this will help them in providing various benefits and various protection schemes. Then they will be covered under PM Jan Arogya Yojana, and this will extend healthcare benefits to online platform workers, ensuring they have access to necessary medical services. Now, another important provision is the custom duty exemptions for certain life-saving medicines. So, what are those custom duty exemptions? Like 36 life-saving drugs, they are in exempted list, and 6 medicines in 5% duty list. 37 medicines and 30 new patient assistant programs are also in exempt list. So this custom duty exemption, it helps in lowering down of prices of life saving medicines to a large extent, and makes these life saving medicines accessible to poor population. So this is again a very important provision. Now we have to see how much it materializes on the ground. Now talking of some other provisions which are social determinants of health. For example, Jal Jeevan Mission. So it has been proposed that there will be 100% coverage under this Jal Jeevan Mission until 2028. So let us see how much is done on the ground. Then Urban Challenge Fund. This Urban Challenge Fund of 1 lakh crore rupees will be created to implement the proposal for cities as growth hubs, creative redevelopment of cities, and water and sanitation. So this water and sanitation, important social determinants of health. So provision has been made for these components also. So friends, lastly, I would like to say the health has not been given much priority in the budget. So more of priority should have been given to the health, as the developed nations, they spend 6 to 8% of their budget on health, and we hope that in the coming budgets we will also spend a larger amount on health, and whatever we will spend, it will be cost effective, and we will see some groundwork to be materialized, and we will see development in our health sector, and good health for our people. Thank you for watching.